Welcome everyone. Today is October 18th, 2021, and we are recording our show for October 20th. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency medicine physician with Dartmouth-Hitchcock Health. And this is Medical Matters Weekly, a show about the aspects of healthcare that matter to you most. My guest today is Dr. Vanessa Britto, Associate Vice President for Campus Life and Executive Director of Health and Wellness at Brown University in Rhode Island. Welcome, Dr. Britto.
Thank you, Trey. It's a pleasure to be here with you.
We are so excited to have you, and I'll address you as Vanessa since you addressed me as Trey. We'll keep going like that.
If that's okay.
That's great. We have, she has quite a bio. Let me just get some high points here for the audience. So a bachelor's in sociology from Dartmouth College in New Hampshire, did her medical school at University of Illinois at Chicago, and board certified in internal medicine. Then went on to a master's of science in community health and preventative medicine from Brown, which is where you are located today. But first you were at Wellesley for a while. What did you do at Wellesley?
Well, at Wellesley, I directed the health service, oversaw all the care that was provided there for students, and had a wonderful time kind of stewarding a community's health.
Oh, that's great. A lovely person in my life attended Wellesley College, so I get to hear about it in the evenings when I go home. And she was also inducted as a fellow of the American College of Physicians and awarded the Rhode Island ACP Women Physician of the Year in 2021, this year. So you just got this award recently.
I did. I was quite honored and surprised. And it was just a really wonderful accolade to receive from my peers here in Rhode Island.
That's fantastic. So I was asking you, you're in Rhode Island, I was asking where you're calling from, and you mentioned this is a new building. So tell us about this building.
Yeah, so I have the great pleasure of overseeing a number of departments here at Brown Health Services, our counseling service, emergency medical services. We have a full-scale premier college EMS program. We have accessibility services and our BWell Health Promotion team. So those are the departments that are in my portfolio. And up until this time, maybe about 2 months ago, we actually had our offices kind of in different areas of campus. And I was asked to come back about 4 years ago, and at that time, Brown really had committed to reimagining how health and wellness would be experienced by students, and had decided to, as a result of the generosity of two amazing families, the McMillan family and the Sternlich family, had decided to build a building to co-locate 4 of the 5 services. And so we managed to create this amazing, beautiful state-of-the-art building together, really centering the students' experience. We really wanted to capture how we wanted students to experience these 4 services together, and built had a residence hall built on the upper floors. So we have 162 beds in this amazing, beautiful new health and wellness center in this hybrid building, and managed to get it built through the pandemic. We had a mild winter.
Wow.
And so literally the last of the departments moved in about 2 months ago. And so we've been able to start the school year here in our new space. And I'm just thrilled. It's just an amazing opportunity. And we'll actually be formally dedicating the building this week.
Oh, that's great. So, and I can see that space for the audience that is listening by podcast. You can't see it, but it is beautiful. So before we get into really the topic for the day, I just want to introduce you to the audience and the audience to you. So tell me a little bit about your background and how you became interested in medicine in the first place.
Sure, thank you. So I actually grew up in Massachusetts, right at the gateway to Cape Cod in Wareham, Massachusetts, a small town. And I'm a public school kid, first gen. And but someone along the way, a high school teacher, recognized an aptitude, he said, for the sciences. And I thought I was going to go the way of sort of government and sort of public service and, politics, et cetera. I was very involved in student government. And but he managed to persuade my parents to direct my interest toward medicine. And so while at Dartmouth, I majored actually in the social sciences because of my love for the community and people, and took the sciences and went on to do a post-baccalaureate program at Bryn Mawr, and then applied to medical school, and the rest is history.
That's a great story. And you have a focus towards preventative medicine, is that right?
Yeah, I do. I'm an internist. I think part of the tradition being in internal medicine is you're sort of the great discoverers. You're just sort of peeling back the layers to try to understand the underlying issues that are creating a problem. For me, as I went through training and began to practice in community health in public settings such as community health centers, et cetera, I really became acutely aware of the need for more focus on sort of the upstream issues. Back then, we didn't really have the fancy terminology for social determinants of health.
Right.
But here at Brown, what I was taught was how to treat the whole patient. Think about the context that the patient lives in. Think about, the things that surround them before they get to your office. And so I began to really want to impact to a greater extent what was happening before the crisis that led to the emergency room visit, quite frankly, or the admission to the hospital.
Sure.
And that's also part of why I got a master's in community health, was to think about the population's health and think about, the things that went into creating a healthy community. And so, so that's how I became more and more drawn to preventive medicine. And this is really how I got, I think, interested in college health or student health, because I started to think about the times in our lives when we're starting to develop those good habits and thinking about our health and well-being. And those are the times, it seemed to me, to begin to create more healthy habits and give people information and help them to be critical consumers of the healthcare system. And so it sort of led me to student health. And that's eventually how I arrived back at my one of my alma maters here at Brown, and leading this charge.
And getting into academics too, which is, has its own benefits, the educational aspect. The audience here, Vanessa, happens to be pretty knowledgeable about terms like population health and social determinants of health, because we've done several shows. In fact, the last week, our whole focus was on our community needs assessment in the southern Vermont and also eastern New York and northern Massachusetts, where we all sort of have a health service area. And so we've heard those terms. They are still good to review. It's still good to talk about. And you're right, by identifying these folks at a younger age, at a time when they can make these changes, I think is incredibly important. And it's probably rewarding for yourself as a physician.
It is true. Although I have to say, there are those moments, we all experience them, where you have a day when things haven't gone quite the way you've expected them to go. We have to remind ourselves, especially here in this kind of setting, that, we see people for a prescribed period of time, whether it's, maybe it's 4 years as an undergrad, maybe it's longer if they're here as a graduate student. And we don't always get to see, the sort of full culmination of everything that we've either talked with students about or hoped for, but we get to plant the seeds.
Right.
And every once in a while, they'll come back and they'll say, I had this conversation with you and now I'm doing this and I am hoping and helping to impact, people's lives in this way. Or I've had this revelation for myself many years later after having this conversation or changing something that I've been doing. And it's resulted in this good way. So yeah, it's a very interesting opportunity.
As an emergency medicine physician myself, I often comment that 30% of the patients that are in our emergency department in a given time really shouldn't be there. And people think that I'm talking about the folks that are in the emergency department, and I'm not, because they clearly need to be there. They're very sick. But what I mean is they shouldn't have gotten that sick to begin with. We need to do better preventive medicine to help them, whether that's early intervention with socioeconomic needs, food insecurities, smoking, and all of the social determinants of health that you are working on. So thank you for what you are doing, because that will make the next generation more healthy. And let's go in then to some other preventative medicine topics, and that is COVID vaccination. So
Sure.
Brown made big news this spring by being among the first private colleges in the United States and one of the first colleges in the country to announce mandatory COVID vaccine, or what I like to say is a condition for membership in the university. You had to get vaccinated, with rare exceptions. So tell us some of that story. Who are the key players in the decision, and how it really came about? Because I'm certain it didn't happen in a brief afternoon meeting.
No, it did not. Well, I think we experienced what everyone experienced in that spring of 2020, when we all had to pivot and do something differently. And so we sent all of our students home, and we certainly had a small number who were international students who were sort of caught and not able to go back to their home countries. It was just a challenging time. In that moment, however, a whole group of people, came together to really think about how we were going to navigate this terrain. What were we going to do that was going to be different? We had policymakers from, sort of at my level all the way up to the president, who were fully engaged in some aspect of this conversation. There are whole teams of people that were thinking about all kinds of things. And so, fast forward to, getting through that summer and last fall, we had to make some challenging decisions about how we were going to populate our campus, who was going to be here, how we were going to stand up a testing program that would keep the community healthy. Where were we going to house people if they tested positive? What would be the systems that would wrap around them so that we could help them continue to get through this time and still have some educational metrics in front of them. It was really, really challenging. And as we got closer and closer to, I would say, late fall, when the discussion started to turn toward, we're gonna have a viable option in terms of vaccines that are going to be made available to people, we obviously were dialed very closely into the conversation that was happening nationally. And so as it became clearer and clearer that this would be a way for us to be able to open our doors and allow students to come back, not just here in the US even, but how are we going to invite students back who are all over the globe? It was very clear that vaccines had to be foundational in that. Now, our president, she's a very bold leader. She's a thoughtful leader. And, she's a healthcare economist, as you may also know. So she thinks about the world in a very healthcare focused way, which is great. So, all of that good thinking went into us making the determination that that really had to be front and center in terms of how we would be able to invite students back to campus and allow them to, again, resume their lives and have a meaningful college experience, so that, we were giving them an opportunity to do all those wonderful things that are associated with, going off to college and embarking on that next chapter in their lives. So yeah, it was all the way from the president on down. I mean, she led the charge. She threw down the gauntlet. And so, we knew that this was exactly how we needed to move forward.
So, I think when I say we here, I'm going to mention those of us in medicine, whether providers or support, recognized a long time ago, as you said, fairly early in this pandemic, especially when vaccine was looking to become a reality, that businesses and universities and schools that required vaccination were going to have significant advantages over those that did not. And that's totally played out. I think a lot of people don't go to the second and third level of thinking, and that is the resources, the unbelievable resources that are required if you don't have a mandate in place. It'll drain you financially, and then it will drain your staff. And then, of course, there is the major aspect, which is the safety and health part. But what Brown did was a little unique. When I went around and started talking to universities and hospitals, healthcare organizations, they were agreeing, but they didn't want to be first. They wanted to follow the masses, but you can't follow the masses unless the masses begin. That had to have been, beyond just a decision, that had to have been an enormous strain on you and your colleagues and on the president, because I'm sure they were meeting resistance from previous students and board members. Do you have anything to add on that? Because I can imagine being the fly in those meetings, fly on the wall.
There were, I would say, there was lots of very heated conversation. But again, I think that we all knew in our heart of hearts that it was the right thing to do. So, it's one of those situations where you have to sort of stand in your truth, as they say. And, we knew the headwinds would be there. But it was important also to be thoughtful about the timing of this announcement, if you will, or the decision, because to do this, we knew that we'd have to garner resources from literally all over the world, right? We had to give people time. We had to set up a structure to allow people to send in their information. We had to have the right people looking at the information. We had to be in communication with folks. We had to reassure people who, pushed back and said, we had a very Western-centric way of looking at this issue. There were places in the world that people couldn't access vaccine. And so we were asking them to provide documentation or requiring vaccines of them that they couldn't access. And so we wanted to reassure them that we understood that. We were fully principled around equity and said, just get here. We'll find a way. If you can get here, we will find a way to get vaccine to you. And so we had partners here at the Rhode Island Department of Health, partners in the community, partners on campus. And so, it just became this hugely complex machine with lots and lots of moving parts. But there was a center that was coordinating, what was happening and communicating with people. So it's not over. We have, we're grateful to have a highly vaccinated campus. I think when I last looked, I think we have 99.8% of our students who are
Wow.
vaccinated, and it's pretty close to 96 or maybe even more percentage of our faculty and staff employees who are vaccinated. So you're right, allows us to have capacity to do some things that maybe we wouldn't be able to do, or others haven't been able to do, without being able to rely on the fact that we have a very highly vaccinated community. I mean, we're
Sure.
still porous, we're not in a bubble,
Right.
but we have our own version of that, if you will. And so, it's a pretty residential campus. And so, we have been able to establish an infrastructure to support the students who are here, even the students who are living off campus. And, we have been in communication with our Human Resources Office, who has been working very closely with the employee population as well to almost mirror what we're doing on the student side. So we've learned a lot. And I'm really appreciative of the cooperation of the community, and we've I think managed to open the doors and are off to a really great semester.
So yeah, that's great to hear. What mitigation measures are still in place right now? I know it changes regularly, but
Yeah.
are students wearing masks in classrooms?
Yes. So right now we still have indoor masking that we're asking people to adhere to. Faculty have the option, if they're vaccinated, to not wear masks. So that, but that's pretty much the exception in terms of masking. We still are testing. We've gone above and beyond the CDC's guidance. So right now, even for vaccinated students, undergraduate students, we are still asking them to test once a week. For people who have exemptions, we did allow for an exemption process. So there are people who have medical and religious exemptions. But if you're unvaccinated, or as we say, on the pathway to vaccination, if we're, we're sort of working with you to get there, we are having those people test twice weekly.
Okay.
So there's still, a fair amount of testing going on, which is good because it gives us an opportunity to identify any positive cases and, have those people, if they're students, we have a designated isolation housing arrangement set up locally. And, if they're employees, they are asked to isolate at home. There are lots of really good, I think, systems and processes that have been set up to support staff. They get sort of a special leave that doesn't count against their vacation and sick time, that gives them an allowance, a 10-day allowance for isolation if it comes to that. And then again, campus partners who are very helpful to support students as they're, if they're having to isolate. Our student support services deans and our faculty, et cetera, are aware. So
sometimes I get this question often, and I know you do as well, and the audience may be thinking this. They're thinking, wow, so you've put forth all this incredible effort towards vaccination, and yet the processes are still the exact same as far as mitigation measures. And I get that question a lot, and it doesn't take long to explain it for people to understand. The reason those measures are still in place, right, is the prevalence of the virus is still really high. And there's still a large population of people who have no immunity, either from prior exposure or from vaccination. So it will not continue. We will not continue to have all of these mitigation measures in place as they are today. And in fact, in most places, all the mitigation measures can be removed when the prevalence of the virus decreases,
right.
As long as we can get these high vaccination rates and immunity through prior infections. In the hospital systems, who knows? We may stay like this, and that's probably okay. It decreases lots of other spread of pathogens in the air, and so we probably should have listened to this long ago. But in these community settings like universities and public settings, we won't continue doing this, and the prevalence will decline. I'm very happy to see the declining rates around the country, as I know everyone is, but I am a little cautious because if it stops the vaccination effort, then we're just going to see a rise again at some point as those folks become exposed to the virus. So hopefully we'll continue this push and get a good 75 to 85%, knock on wood, once the children start to become eligible. That's my spiel on that subject.
That's a great one. I may steal elements of it.
So when we look at Brown specifically, and you talk about the difficulties, and what I think about is the community's evolution in thinking, right? So all you do all day is think about this stuff, right? At least that's all I do. I'm sure that's all you do. Yeah. So your thought process is more advanced because you've had the opportunity. Then you have to sit down, and you said something very important. You have to listen and support people as they go through their own processes. Have you lost staff or lost students who just can't come to terms with these requirements?
Fortunately, the numbers are very small. I won't say we haven't lost any. There have been students who have decided that they wanted to take a semester off, that they really did want to take a little more time, or that they needed or wanted to study remotely. We've had people just decide that they wanted to pause. I would have to talk with my colleagues on the academic side of the house to see how many have actually transferred. But I think at the moment, those people who are, for whatever reason, not comfortable being here right now, I think it's really more a temporary issue. They're sort of hanging back and waiting and watching and listening, and they need to get there in their own time. On the staff side, again, I would venture to say that if there have been people who have decided to leave the institution, I think those numbers are very, very small. As I mentioned, I think once Brown made the decision, it did. What came with it was sort of a whole, a whole panoply of support systems and processes and other things to help people get there without it becoming more and more burdensome for them. Right. So I think we tried to make it easy as opposed to make it hard.
Sure.
So.
It seems based on media reports and then also just internal knowledge, talking with colleagues, that so many organizations, whether they were universities, businesses, or healthcare organizations, have not experienced that mass exodus of folks that were feared. And, thank goodness, because staffing shortages are real and inhibit our ability to, if you're a university, provide education, if you're a health system, provide healthcare. It is painful initially, but I do know that I believe in my heart that it is well worth the effort, because it leads to greater efficiencies that we discussed about, and of course safety, which is why we went into our fields in the first place, to limit suffering and help others.
Of course.
So,
yeah, the only other thing I would add to that is just to say that I think this is also when the mission of the organization really does come into play. I think if you walked around campus, the one really great and consistent thing that you'd hear is that everyone who's here, who is here of their own volition, and they're here with this commitment to the mission. And, that's what the vaccine has allowed us to do, is to be able to get back to that and be able to do it in a safe and healthy way.
Yeah, it's a culture of supporting a community rather than a focus on individualism and self-needs. And I just think that's wonderful. So when you get past COVID, and I think about this all the time, but I just can't get past it, but someday we will all get past it. What ambitions do you have for your work there at Brown?
Yeah, well, that gets me back to being in this spectacular new setting, this brand new building. The idea in coming back to Brown was to be able to help the institution, help Brown think about how we're engaging students in their health and well-being. So we are getting back to that. We have, ideas for innovative ways in which we want students to experience this work. This is the first time Brown has built a new residence hall in 30 years.
Wow.
And so we have a living learning environment here that's brand new. And we are so hopeful for the future. We have some wonderful new ideas, thinking about it almost as sort of an incubator of ideas, There is, for example, a wellness peer education cohort of students who lives in this building, and they're joined by, 160 other students who have applied to be here. So they all have ideas about what that commitment to a healthy lifestyle means for them. And so what we want for them to do is to be thinking about how they can plant these seeds in other parts of campus. You can live here, but this isn't the only place where wellness should happen.
Right.
We want you to fan these ideas out. We'll help you do it. We'll help you think about it. And we want you to be in an environment that's going to sort of help you be creative in that thinking. So yeah, we have some really fun and exciting ideas about how we're going to go into the foreseeable future here.
No, that's fantastic. And I look forward to staying in touch with you and learning about these. So everyone, I'd like to thank our guest, Dr. Vanessa Britto of Brown University. Thank you so much for joining us.
Thank you so much, Dr. Dobson. Trey, it's been a pleasure. I really will look forward to our next conversation.
Great, we will have you back. I'd also like to thank Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, Ashley Jowett from Southwestern Vermont Healthcare. Next week, we will have Rebecca Bell, a pediatrician from the University of Vermont in the intensive care unit, to talk about COVID vaccines for children. Send your questions to her at wellness@svhealthcare.org. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity, and we will see you next week. Great, we're done. Thank you so much.
Thank you. It was a pleasure.
Oh, that